Ladies and gentlemen, this picture that you see are nurses from Riverside, California. They are one of many that are complaining about shortages once again of mask gowns, face shields, gloves, and some of these nurses are working without taking any breaks. They can't even take breaks because it is just so many people going to the hospital and they have to do everything they can to care for these patients. And they're saying they are worn out, which I can definitely see. I think some of these nurses probably never worked so hard in their whole careers as they have during this pandemic. So this came out in the Washington Post, July 8th, 2020. Healthcare workers on the front lines of the coronavirus pandemic are encountering shortages of mask gowns, face shields, and gloves, and a frustrating reoccurrence of a struggle that haunted them the first few months of the crisis. So the nurses are saying they are once again reusing N95 masks for days, even weeks at a time. Doctors say they can't reopen offices because of the lack of personal protective equipment. State officials say they have scoured US and international supplies for PPE and struggle to get orders filled. Experts worry the problem could worsen as the coronavirus infections climb, straining medical systems, which they're already strained, y'all. A lot of people thought once the alarm was sounded back in March, surely the federal government would fix this, but it hasn't. So they're saying the nurses union are saying, like many healthcare workers, they blame Trump and his administration for the lack of equipment, noting the administration has insisted the responsibility falls to the state and local officials, with the federal government playing only a supporting role. The specter of equipment shortages come as other issues that plague the country's early response to the pandemic return, surging cases, overwhelmed hospitals, lagging testing, and contradictory public health messages. But the inability to secure PPE is especially frustrating. Healthcare workers say because it's their main defense against catching the virus. For weeks, nurses have posted online testimonials about lack of PPE, with given surgical mask instead of N95 mask because of shortages. In a video posted last week, a Florida nurse said she breaks the oath she took to do no harm every time she goes to work without protection and worries constantly she may be infecting her patients, coworkers, and family. In interviews, the White House officials say concerns over PPE shortages are overblown. They said US manufacturing and stockpiles of protective equipment have improved dramatically and are adequate in most states. Well, most states, so that you're acknowledging there's probably some problems in many of the states. Okay, so what are you saying when you say most states? I'm not going to tell you we're able to meet all demands, but there's significantly less unfulfilled orders today than in April. All right, so this is what a spokesperson from Trump's administration is saying. President Trump put in charge of coronavirus related supplies. I have not found a hospital system that is in threat of running out. I don't have a sense of there being severe shortages. Well, these nurses are saying the total opposite of what Trump's administration is saying. So that is a problem in itself. The Trump administration has helped increase domestic manufacturing of PPE And the demand continues to outstrip supplies because hospitals, state, and federal government are trying to stockpile supplies. He blames some of the concern about shortages on outdated letters to Congress from March to April. Well, these nurses are on strike in July, and it has nothing to do with their contract. It has everything to do with the working conditions that they're under. But the administration's resurgence contrasts to the growing alarm from medical associations, governors, nursing homes, and members of Congress, all of whom have pleaded for federal help within the past month. Demands for the protective equipment has soared, unlike in March, when efforts focused on getting PPE for major hospitals, especially in New York, Detroit, and Chicago. Supplies are now desperately needed by primary care offices, nursing homes, prisons, and psychiatric and disability facilities. As many states continue to reopen their economies, demand has also surged from the construction industry and other sectors. With soaring demand, pricing and have skyrocketed. Yeah, I was reading about how many people in construction are now getting COVID. Okay, so some hospitals say much of the PPE they have acquired has been, they're saying that it's been very overpriced, way higher from what they have normally spent in the past. At a legislative hearing, a hospital association executive detailed how one Maryland hospital spent $600,000 on PPE last year, expects to spend $10 million this year. Wow, what a huge difference. You spent $600,000 to make sure you had PPE, and this year it's $10 million, and you're still struggling to get this stuff? The struggles have been especially acute for smaller and rural providers that can't compete with bigger healthcare systems on price and large scale orders. Wow. A letter last week, the American Medical Association told the Federal Emergency Management Agency that doctor offices outside big systems, including those providing primary care, chemotherapy, and minor surgeries, have struggled to reopen because they are unable to secure PPE. The association, which pleaded for transparency and a coordinated national strategy, said it is unclear whether the central problem is in the availability of raw material, production backlogs, gaps, and distribution systems, or some combination of all three. Wow. I tell you what, I sure wouldn't want to be out there doing what these nurses do in this situation. You know, I know they are all doing the best that they can out here under the circumstance, and they deserve a lot of credit for that. But it really sucks that they are in the situation they're in. Now, I actually saw last week when the hospitals were saying, the amount of people coming have surged. I knew sooner or later they were going to have this problem again. And look, they had this problem in March. This ain't even 6 months out. This is July, and they're having the same problem with PPE again. That is outrageous. But y'all, it just goes to show you, again, leadership, poor. It's been poor. It just didn't start this way. It's always been this way. But see, now this virus is really bringing it out. You have to blame the leadership for what you're seeing. It can't be blamed on anyone else. But y'all, please tell me what you think. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Pieces. Pieces. Peace, family. Okay.